Hello, everybody. Thank you for listening to the Healthy Project podcast. I'm your host, Corey Dion Lewis. Today, I got another great guest with me in the building today,
Thank you.
talking about a profession that has, when you think about community health work, we should be talking about this a lot more because it's doing some
Definitely.
really, really important things in not just our community here, but community health workers across the country.
Yes.
We have Chrissy here with Carelon
hmm
Health. Chrissy, thank you so much for being here. I
Thank you
really
for having me.
appreciate it.
It's an honor.
Yeah. So, before we get into the conversation, talking more about community health work, what you do, and the impact, tell me a little bit about yourself and what gets you up in the morning.
What gets me up in the morning? I feel like I finally found like my niche, something that I actually look forward to doing. So, what gets me going is just the day-to-day basis. What I'm looking forward to is just having the direct contact with the patients. When they come into the clinic, just being able to know that I'm going to be make a difference in their
Right.
life. That's rewarding to me.
Yeah. So you talked about your journey. Share with us how did that journey start? How'd you get from where you were to it clicking for being a community health
And
worker?
that's a good question. So, I was a medical insurance coordinator for 14 years. And I loved it, but it was more like behind the scenes, helping
Mm-hmm.
patients with like deductibles, out of pockets. But I always wanted to do something like in the social work, healthcare field. Um, and what kind of drove me to this is because I work in the community that I grew up in. So that was like a
Okay.
strong passion for me. So a lot of the patients that I see are actually maybe people I grew up with, or I've seen a couple family members come in there. But just being able to be an advocate for people in the community because they don't have a lot of times they don't have that voice.
Right.
So just being able to be a positive force for them.
Yeah. So what does that day look like? So I know you see people in the office, and I'm sure
Yeah.
you're out in the community doing stuff too. So
Yes.
for those that don't know, who have never heard of a community health worker,
hmm
those that are listening or watching probably have, but those who
Right.
have not, what is a typical day of a community health worker? What does that look like?
Typical day for me. So every day we get like a discharge list of patients that go to the emergency.
Okay.
So we make outreach calls to them just to follow up with them to see if they want to schedule like a post hospital, post ER follow up appointment. So we're their like primary main contact after they're discharged.
Okay.
So even a lot of times they don't want to schedule like a post ER follow up appointment. So we just let them know we also offer physicals, immunizations. We are assigned as your primary care provider. A lot of times they don't know who they're assigned to. So just
Mm,
making that awareness, even if you don't want to come in for a hospital follow up, we offer different services just to kind of just to let them know that we care about their continued care.
right. So you really help with that transition to care,
Yes,
and doing a lot of those things, which is important
very.
because one, when they leave the hospital, like they need there's things that they need,
Yeah,
and I've experienced, now I'm not a community health worker, but I've experienced people leaving the hospital and not getting their medication, or
definitely.
not even knowing they had something at the pharmacy, like
Yeah, they a lot of times they don't know, and
yeah.
unfortunately, what I've noticed is a lot of people use their emergency room visits as their primary care provider. I
Yes.
mean, and not only is that expensive with insurance in the healthcare field, but they use that as a constant. I have a cold, I have a cough. Not saying there's anything wrong with that, but we want them to continue to follow up not just at the emergency, but with their primary care physician.
Right. Have you ever do patients, do they follow up with you, or are you always making the direct contact? Like, how does that work?
Yeah, so they do follow up with us. We make it aware we're their primary care provider because, like I said, a lot of times they don't
Mm-hmm.
know. We get patients that come into the clinic on a regular basis that are regular patients, but a lot of times some patients just go anywhere. They don't really look on their card because if you look on your card, it says who you're assigned to. They just kind
Mm-hmm.
of go anywhere. So we make that awareness know, if you need a checkup, physical, please make sure you're coming to your primary because they're actually assigned to us.
Oh, got you.
Yeah.
Got you. Um, you said you're from the community and you work in the
Mm-hmm.
community that you were born and raised in.
Yes.
I find that as such a cheat code for
Right.
the community. People are like, oh,
Yeah,
you
because
know
I
how to talk
know
that
the
talk.
resource. I know the
Yes.
resources. I know the community. The people are familiar. And I think not only familiar, but they're comfortable. Like they see a familiar face and they're more open and prone to, okay, this is someone that I can relate to.
Yeah. Have you ever experienced someone telling you something because they know you that they probably should have told their provider?
Yeah, and that's the thing. That's where that comfort comes into. They're like, hey, I'm going through this, that, and other. I got kicked out of here. I mean, because we do, as a community health worker, we do help with food, shelter, clothing. A lot of patients might have like substance abuse, behavioral issues, so it can kind of get personal. So I have to kind of set those boundaries. Like, you might want to let your primary care provider know. They'd be more than willing to help you. So
Yeah.
I'm
Yeah.
like the mediator, but I don't want to get too too involved. But I want them to be able to be open with telling me what's going on with
Yeah.
them.
Well, there's something to one seeing somebody that looks like you,
Yes.
or someone that they maybe view that's not really in the health, like not really in the healthcare
Right.
space, even though
Yep.
you are.
Yes.
But you're seen as, oh, you're in the community.
Yeah.
I can trust you.
Yes. I can trust. That's the thing,
You know
and
what I
it's
mean?
about building that trust and that communication and that rapport so that they feel comfortable.
Yeah, 'cause there have been many times where I've had to tell people, I have to tell your
Yeah.
doctor what you just told
Yeah.
me.
Yeah, exactly. Just so you know, I'm letting your doctor know. Just so there's no confusion, I'm gonna put it out there. I'm gonna let your doctor know. Yeah, yeah.
Yeah,
You have to. I mean, that's like, kind of like a mandatory reporter. I mean,
absolutely.
you have to have the patients. Nothing. It's, you can keep it like personal to a certain extent, but you have to put their interest, their health as their best interest.
Absolutely.
Yes.
Absolutely. Um, what are some of the challenges you feel like you've experienced since you've been in this role? Has there been
Oh
anything that's
man.
been the challenge for you?
I would definitely say there's two, and I'll keep it short because I'll go on and on. But I would say two, it's homelessness.
Mm. Oh my
That's,
gosh.
it's really sad because, and it's not just in our community, it's everywhere. I mean, it can be from the east side, the south side. I've even seen West Des Moines. It's everywhere. So patients will come in for appointment and they're like, I'm homeless. I need somewhere to stay. And it's just finding those resources for them. It's hard because there's waiting lists or there's no openings or you have to meet certain criteria, or it's just a lot of stipulations when it comes to finding shelters for patients. So that is a struggle, and I think food insecurity.
Talk about that when you say food
I would
insecurity.
say food insecurity because a lot of times patients come in and that's another thing that they struggle with is food, but it's like we can give them the resources as far as where pantries are located, but they may not have transportation.
Right.
They don't have that access to care type of, okay, here's the pantry, but this, you need to go here these specific days and times, and some people, they can't go that specific time frame or they don't have
Right.
transportation.
Which the transportation one has been, I've been on a big transportation kick
Yeah,
lately because you're right, it's a
right.
huge one. And if you don't have, first of all, depending on the food pantry you go to, depend is what are you going to get there that's
Yes.
nutritious.
And the thing is, a lot of patients are diabetic, so they're like, I can't give you a bunch of donuts and Krispy
I
Kreme
know.
and pastries. I mean, something is better than nothing, but a lot of times they're like, do you have any healthy food items? And
Yeah,
if we don't at that time, it's kind of like, this is unfortunately what we have right
this is what
now.
we have. Exactly, and that becomes a problem. And I'm not saying there aren't pantries out there that don't have
Right. There are definitely
fresh fruits and
some.
vegetables, because
Yes.
there are some. But again, what about that person that can't get there,
Yes.
or during the times that are there? You know what I
Right.
mean? That makes it a lot harder.
Definitely.
So you talked a little bit about being in the community and working with patients with, getting them transition to care. You talked, finding them resources. I know a big one that has been a major focus for you two lately has been the Medicaid
Redetermination.
redetermination.
Yeah.
Talk about how you're working with patients with that, and what's that process been like?
That process, it's a difficult process, but I think it comes into play as far as the communication and the information. And I've been guilty where you get something in the mail and you just kind of set it aside, or it gets lost in the drawer
Yep.
that has a million things in it. But just letting the patients know beforehand, this is what you can expect. You're going to be getting some paperwork in the mail. A lot of times when they send out like redeterminations, you have to reapply or reinstate. It's time sensitive. So you have to fill out that information and get it sent back by a specific time. If not, your benefits can be canceled. And then it's a process of getting reinstated and or not even reinstating, but just completely reapplying. Submitting all your information, which is a whole nother headache. A lot of times with that, or in certain situations, there's communication or language barriers. So you might have a patient come in that doesn't read or speak English. So just being able to come in and, as a community health worker, making that call for them, I'm getting an interpreter on the line so that they understand this is what this says and this is what this means. Right. So it's a huge communication, just being that advocate again, just letting them know, just walking them through the steps from like the beginning, the middle, and the end. Don't just say, this is what you can expect, this is what you'll find out in 6 weeks. But just let them know the whole process.
Right. And that's what I was curious about, because there are people there that are don't speak the language, maybe can't read the language, or maybe don't have low literacy to begin with. And they can see it, but they don't know what it is.
They don't know, so that's where, and that's why with a community health worker, I would say you have to have a lot of patience. It's not like, and things are always changing and unexpected. So you have to be able to be patient, listen, be an active listener. Don't just tell the patient what they want to hear, but actually break it down to them, and then get their, like, what their understanding and their comprehensive level is. So that's important.
Mm-hmm. Do you find yourself kind of coaching more as a community health worker? What is that like?
So I am a certified life coach too. So I feel like I have like these certifications that kind of help me as a community health worker. So I have like a mental health certification, community health worker so they kind of help you with those communication skills with your role.
Right.
But a lot of it, to me, I feel like it kind of comes naturally, but those things are just extra perks.
Oh, it is just being able to know how to talk to someone,
or just to understand yourself, to be able to understand others and why they are, how they are. I think understanding yourself and being able to be open-minded. You really have to be open-minded. Oh my goodness. Yes. Definitely.
How has the COVID pandemic affected your role as a community health worker, particularly in the terms of community outreach and patient interaction?
So with the COVID era, that was pretty difficult because I'm a people person and I'm more about patient engagement and face-to-face interaction. So during that time, we did a lot of knocking on doors. And during that time, it was hard because during COVID, people didn't want to be within so many feet of people.
Don't come to my door.
Don't come to my door. They're peeking through the window and like shutting the curtains.
Right.
But that was hard just because we did lose a lot of patients because they weren't leaving the house or they weren't coming in. But just sending out flyers, knocking on doors, making phone calls, just continuing to keep that patient engagement.
Yeah, I would find it to be very hard if you're supposed to be in the community.
Right.
And there's something that you can't control.
Yeah.
It's keeping you from doing that and having to get creative with that.
Exactly. So we tried every alternative that we could think of.
Yeah.
I mean, we had some success rates, but I'm just glad that we are where we are now.
Right. Oh, absolutely.
Yeah.
What advice would you give somebody who's wanting to get into this work of community health work?
I would say don't get discouraged or don't think it's something that you can't do. And I would say with a community health worker or any change, because you're never too old, you're never not educated enough. Like I said, I was a medical insurance coordinator for 14 years, but this is something that I wanted to do. So I feel like life is short. You want to do something. This is, you spend the majority of your day at your occupation doing what you do. So you might as well do something that you love. And if it's something, community health is what you want to do, I'd say go for it 100%. I mean, follow your passion.
Where do you see the profession? Because we hear about it a lot, and a lot of organizations are employing community health workers. Where do you see this going in the future? Or especially with your position, how long have you been a community health worker?
I've only been doing this about a year, but it feels like a lifetime.
Because
I've always been helping people my whole life. So
Right.
now this is like my job. So I feel like I've been doing it my whole life, but I've been doing this about a year.
Yeah.
And
Where do you see it going?
where I see it go, where I would like to see it going is more community health workers coming together. Just as far as like sharing their resources and sharing what works for them and what doesn't. Because I feel like a lot of my connections are from either coworkers or it could be, I have like a couple connections at churches, and that's where I find my resources at. Like from churches, I got a couple food pantries set up with that. With schools, just community health workers coming together as far as like what works for them,
Right.
and what
Pulling
doesn't.
resources,
Pulling
helping
resources
everybody.
together.
Yeah, that's so important.
Yes.
That's because we're all helping the same.
We're all
same
and
community.
everybody. I feel like everybody needs help in some type of form or fashion. It could be from a minimal degree to a higher scale, but we all need some type of resource or assistance.
Yeah, absolutely.
Yes.
Chrissy, thank you so much for being here.
Thank you for having me. It was
Look,
a pleasure.
that wasn't that bad.
It was
it?
not that bad. I felt calm and relaxed. It was just having a regular conversation.
It's like having a regular conversation.
I can breathe now. I can breathe. Yeah, no, that was, I enjoyed it.
Yeah, for anybody listening or watching that wants to learn more about what you do or just connect with you, where can they find you?
So we are located at 1530 East Euclid. And then I also wanted to say we have a community health fair coming up on May 29th. I'm not sure the hours, but I think it's going to be all day.
Okay.
And that's going to focus on nutrition and blood pressure. So anybody's welcome to come. We're going to start trying to have them at least like once a month.
Okay.
So 1530 East Euclid, Carelon Clinic, and I will be there.
Yeah, well, send me the link. I'll make sure I put it in the description of this episode.
Perfect.
Again, Chrissy, thank you so much.
Thank you so much for
being
having
here.
me.
Yeah, and everybody, thank you for listening to the Healthy Project podcast. I'll holler at you next time.